Hi, my name's Sarah. I'm going to be your student nurse today. I'm just closing the door for some privacy for you. I'm going to start. I'm going to verify your ID badge. Can you state your full name and date of birth for me?
Haley Distrap, 9/1994.
Okay, are you in any pain today?
Nope.
Any allergies?
Nope.
Okay, so can you tell me today's date?
It's October 4th, 2016.
Okay, and what'd you come in for?
Just a health assessment.
Okay, and do you know where you're at?
College of Health Professions.
Okay, perfect. I'm just going to wash my hands before we start. Patient appears her stated age of 22. She's alert and oriented times 4 to person, place, time, and situation. She's well groomed and neat. She's clean, no body odors coming from the patient. Her mood is congruent with affect. It's appropriate for the situation. She's not flat or agitated. Her speech was clear. I didn't notice any signs of aphasia or dysphagia. Okay, I'm going to start my head to toe assessment now. I'm just going to inspect the head. Her head is normal cephalic. Both eyes are round. Her nose is midline. Her mouth is in the center of her face. I'm going to start by assessing the skin. I'm going to palpate. Her skin is dry and warm. There's no excess moisture or sweating on the arms or legs or her feet. I don't notice any scars, no tattoos, no bruising on the arms or legs. She does have some freckles, but there's no abnormal lesions. If she had any abnormal lesions, I would use the ABCDE scale, which stands for asymmetry, border irregularity, color, diameter, and elevation. Okay, good. I'm going to start now by assessing your eyes. Both eyes are the same shape. Both pupils are round. They're both about 3 millimeters. Now I'm going to test your pupillary eye reflex. If you could look straight ahead. Good. Both pupils constrict appropriately. Now I'm going to test accommodation. If you could follow my pen. Pupils are equal, round, reactive to light, and accommodation. I'm going to check your conjunctiva. Conjunctiva are pink and moist. They're not dry or too red, and there's no discharge noticed. I'm going to test your cranial nerve 5, your trigeminal nerve. If you could close your eyes for me. Do you feel that?
Yes.
Okay, and I'm going to test cranial nerve 7, your facial nerve. Can you smile? Puff your cheeks. Raise your eyebrows. Cranial nerve 5 and 7 are both intact. There's no facial drooping. I'm going to check your mouth now. If you could open your mouth and say ah, stick your tongue out. Okay, hypoglossal nerve is intact. Her uvula is mobile. Tonsils are present. They're at a 1+. Her inner mucosas are pink and moist. There's no lesions or bleeding noticed. You can close your mouth. Her teeth are white. There's no chipping or cracking, no partials or dentures noticed. And her gums are pink and coral color. There's no bleeding, no retraction. Okay. Next, I'm going to palpate your carotid arteries one at a time. Okay. Carotid arteries are strong, normal pulse. Now I'm going to auscultate with the bell of my stethoscope for any bruits or adventitious sounds. Okay, no bruits are present. Next, I'm going to check your radial pulses. Radial pulses are strong and equal bilaterally. I grade them at a 2+. Your brachial pulses, they're also strong and equal bilaterally. I grade them at a 2+ also. I'm going to check your fingers. Her nail beds are clean and pink. Her nails aren't cracking or chipping. Capillary refill is prompt bilaterally, less than 3 seconds. I'm going to test your grip strength. If you could squeeze for me. And her grip strength was strong and equal bilaterally also. Okay. Next, I'm going to auscultate your heart sounds with the diaphragm of my stethoscope. I'm going to start in the second intercostal space, the aortic area to the right of the sternum. Next is the pulmonic area in the second intercostal space to the left of the sternum. Erb's point is next. It's the third intercostal space to the left of the sternum. Next is her tricuspid area and the fourth intercostal space to the left of the sternum. And finally is her mitral area and the fifth intercostal space to the left of the sternum. At that point in the assessment, I would listen to her apical pulse for 60 seconds with the diaphragm of my stethoscope. Next, I would also flip to my bell I would start from the mitral area all the way back up to the aortic area with the bell on my stethoscope, listening for any adventitious sounds or any heart murmurs. Okay. I noticed S1 was loudest at the apex and S2 was loudest at the base. Next, I'm going to listen to your lung sounds. I'm going to start at the apices of the lungs. I'm going to listen for a full inhalation and a full exhalation, so when you feel my stethoscope, take a deep breath in and out. Oh, I'd start 1, 2. Okay, and now I'm going to listen posteriorly. I'm also going to start at the apices of the lungs, going in the zigzag pattern. Okay, I'm going to listen to the lung sounds laterally. Okay, lungs were clear for auscultation anterior, posterior, and laterally. I'm going to check your costovertebral angle for any tenderness. Any pain?
Nope.
Any pain?
Nope.
Okay, and her anterior posterior diameter is 1 to 2. I'm going to have you lean forward slightly. I'm just going to check the alignment of your spine. Okay, her spine is straight. There's no curvature, no signs of scoliosis. I'm going to start my assessment of the abdomen next. Okay. Her belly button's midline. Her skin is tan and pink. It's appropriate for ethnicity. No scars or lesions, no bruising. If I noticed any abnormal lesions, again, I'd use the ABCDE scale. Her stomach is flat. There's no scaphoid or protruding. I'm going to auscultate all 4 quadrants of her abdomen for bowel sounds. I'm going to start in the right lower quadrant, where the appendix and right ovary are located. The right upper quadrant, where the liver and gallbladder are located. Left upper quadrant, where the stomach and spleen are located. And the left lower quadrant, the sigmoid colon and the left ovary are located here. There was gurgling present in all 4 quadrants. If I didn't hear any bowel sounds, I would go back and listen to each quadrant for 5 minutes. I'm going to test for any tenderness now. Pain?
Nope.
Any pain?
Nope.
Pain?
Nope.
Any pain?
Nope.
Okay, I'm done with the abdomen. Next, I'm going to move to her legs. I'm going to feel her posterior tibial pulses. Posterior tibial pulses are strong and equal bilaterally. I grade them at a 1+. Her dorsal pedis pulses, they're strong and equal bilaterally. I grade them at a 1+ also. I'm going to check capillary refill on your toes. Capillary refill on our toes is prompt. It's less than 3 seconds for both feet. I'm going to check for edema. I'm going to hold for 5 seconds. No pitting noticed. No pitting or edema noticed for either leg. Okay, next I'm going to have you stand up, and we're going to perform a Romberg's test. I'm going to have you stand with your hands at your side and close your eyes for 20 seconds. I'll stand behind if you get unsteady. Okay, you can open your eyes. The patient had minimal swing. She did not step out, so she's negative for the Romberg's test. You can sit down. Again, I'm going to have you perform the get up and go test. So I'm just going to have you take a couple steps forward and then a couple steps back for me. Good. The patient's gait was steady and well balanced. She wasn't staggering or falling over. I think that's it.